I am Gillian Holmes and I'm the international trainer for Genesis. So I'm happy to have conducted quite a few webinars throughout the year. This particular one I'm very excited about, as hyperpigmentation is something that I do see a lot within my own clinic and really enjoy getting fantastic results with. So what we're going to look at and cover today is, of course, the topic of hyperpigmentation. So we are specifically talking here about where there is an excess of melanin within the skin for whatever reason. So we are going to look at diagnosis. How do we identify different types of pigmentation? What are the different types of pigmentation? And of course, what we want to cover as well is the treatment options. So here we're going to look at Genesis in terms of the different treatments that you can offer within the Genesis range, but also how do we support that with home care as well. And fantastically, within the Genesis range, as I'm sure you're all aware, there are a large number of products that we can use within home care to benefit individuals' skin health. So the topics we are going to cover today, as I mentioned briefly, so we're going to look a little bit closer at hyperpigmentation specifically. So in that, we want to know, how is hyperpigmentation produced within the skin? Where is it produced within the skin? So we are going to have a look as if we are zooming in on the skin itself. So the topics I want to cover today include melanocyte signaling. So what is it specifically that signals the melanocyte to produce hyperpigmentation? We're going to look at the science and importance of tyrosinase. Now, tyrosine or tyrosinase is probably something that you're very familiar with or have heard of before. So when we conduct treatments to rectify hyperpigmentation, we talk a lot about tyrosinase inhibitors. So we want to look more closely at that. Why does tyrosine in particular play or have an impact on hyperpigmentation, and how can we potentially disrupt that? We're also going to look at types of melanin. So when we produce hyperpigmentation, we actually produce two different types of melanin. So we're going to look at the differences between the two. In particular, we have eumelanin and pheomelanin. So if you haven't heard of these before, they produce two different colours of pigmentation, and that determines how the skin then looks when melanin is stimulated. So of course, we then want to look more closely at utilising the science that we know to improve potentially the clinical results that we can achieve. Statistically, hyperpigmentation, it tends to be a very common issue that people present with when they do attend clinic for either treatment or products. Now, all ethnic groups suffer, so something that I will cover in a little while is talking about Fitzpatrick skin typing. So Fitzpatrick skin typing determines how a skin reacts to certain things, in particular UV exposure, but also ethnic groups will differ in terms of the type of melanin that are present in their skin. Again, we'll have a look at that. So 90% of people over 50 present with some form of hyperpigmentation. Now, as the years progress and as we age more, the incidence and likelihood that we are going to present with hyperpigmentation increases. So it does seem to be the most common reason for seeking the help of a skin professional. But let's think about that individual themselves. So when they're presenting with things like hyperpigmentation, regardless of the cause, it can have a significant negative impact on their quality of life. So how they look when they view themselves in the mirror can significantly impact their daily life. So I want to kind of look a little bit closer, if we can, at the anatomy of the skin. Now, I'm sure this is something that you've seen before. If you haven't seen this particular one, you will have seen a version of it. But obviously, this looks specifically at the anatomy of the epidermis. Now, the reason we look to the epidermis, the main reason we look to the epidermis, is because within that basal layer, that's where your melanocyte cells are. Now, those melanocyte cells are constantly producing melanin, So effectively what we know about the epidermal layer is across most of the body, the skin has 4 epidermal layers. Now, in areas where skin is thick and hairless, you have that 5th additional layer, which is the stratum lucidum, as you can see there, sits directly underneath the stratum corneum. So that effectively gives the skin thickness in areas that we need it for friction. So that means the palms of the hands, the soles of the feet, and also the lips as well have that 5th additional stratum lucidum layer present. Now, what we also know about the epidermis is the cells within there are continuously moving upwards. So they start their journey within the basal layer. They then migrate upwards in what's known as the skin life cycle or keratinocyte life cycle. So as a rule, we would say that that life cycle takes around 28 days. But as we know, that can differ depending on a number of factors. Most commonly, the aging process is something that slows that skin life cycle down, which means cells become a lot more sluggish. They become stuck when they reach the stratum corneum, which can give the skin an appearance of dullness. Now, what happens with the melanocyte in the basal layer is that it is continuously sending melanosomes up through what's called the dendrites of the cell, and we'll have a look at the cell in a second, and depositing it into the skin cells that surround it. When it goes through that skin life cycle, that is what gives us our natural skin colour. And of course, when issues start to take place, overexposure to UV is the most common trigger for hyperpigmentation. So what that means is that those melanocyte cells are stimulated. They then move up through the keratinocyte cells themselves a lot faster in order to protect the skin underneath. So we have a look now at the melanocyte cell itself. So the melanocyte cell, as you can see from the picture there, is a hand-shaped structure. So it has the body of the cell, but it then has the dendrites or the fingers that can help to deposit that melanosome into the keratinocyte or skin cell that surrounds it. So the melanocyte cell itself is responsible for creating melanin within the skin. Melanin itself is created within that melanosome, as you can see. Now, a common question is, does a darker skin type have more melanocytes? Not necessarily. It tends to be that they have more melanosomes, and within those melanosomes, there is more melanin. So the skin cells that surround it, naturally, the skin is quite dark. So there are 2 types of melanin that are created, as I mentioned. That's pheomelanin and eumelanin. That melanosome that comes up through the dendrites is then delivered into the keratinocyte cell. So it physically covers the nucleus of the keratinocyte cell and then is moved upwards towards the stratum corneum. So it's actually a long process for the skin to really receive its colour. And as I mentioned, typically as a rule, it's that 28-day skin life cycle. In order to successfully treat hyperpigmentation, we need to intervene in that melanocyte or melanosome transfer within the skin cell. So there's a number of things that we can actually do in order to achieve that, and that's what we'll cover today. So just to recap there, the melanocyte cell itself has to be signaled. So we'll look to those signals in a second and what exactly they involve. Melanin is synthesized within those melanosomes, and it creates 2 types of hyperpigmentation. Melanosome transfers then to the keratinocyte skin cell, and the skin cell or skin life cycle then begins. So what happens during melanocyte signaling? So what is essential part of this is what's called an MC1R receptor. Now that's your melanocortin-1 receptor. So we all have them. In order for that to be stimulated, we also have what's called signaling molecules. Now, these signaling molecules bind to the MC1R receptor, and two types of signaling molecules will determine the type of pigmentation that is produced. So again, as I mentioned, eumelanin and pheomelanin are the two types of pigmentation that are produced. I'll look at these a little bit closer in a second, but as you can see from the diagram there, the two types of melanin give two different colours of melanin. So it's a eumelanin that gives you the darker appearance to the skin. So any incidence of hyperpigmentation is that overproduction of eumelanin. So the first thing that has to happen is that the receptor needs to be signaled. UV is the most common trigger that will signal that receptor to turn on. Once that receptor is turned on, it then increases the amount of melanin that the skin creates in order to try and protect you. So don't forget that melanocyte cell, I always think of it as an umbrella. It's coming up to protect further damage to the skin itself. Now it's protecting the dermis specifically underneath that basal layer. If we damage the dermis, that's when we see massive skin changes in terms of aging or advanced aging. So the two signaling molecules are, as you can see there, what's called alpha MSH or alpha melanocyte stimulating hormone. Now, alpha MSH stimulates the eumelanin, whereas what's called the Agouti signaling protein or ASP stimulates pheomelanin. It's that signaling process that then turns on melanogenesis. When the ASP binds to the MC1R receptor, it actually inhibits the effects of alpha melanocyte stimulating hormone. So this is what shifts pigmentation towards the production of pheomelanin. Pheomelanin, as you can see, is a lighter type of pigment. So effectively that means lighter skin types, your Fitzpatrick's 1 and 2, typically have more pheomelanin than they do eumelanin. This is sometimes referred to as an MC1R defect or a mutation. So when this happens, and more production of pheomelanin, that Fitzpatrick skin type is more likely to produce freckling or grey hair as a result of that MC1R defect. So technically, if you have that, and unfortunately, I can quite confidently say, I've always throughout my life produced freckles, and I do have grey hair, but I put that down to children rather than that defect in the receptor. If that's the case, then there is some kind of mutation, but it's completely normal and natural for lighter Fitzpatricks to produce more pheomelanin. Now, when the signal binds to a receptor, it kickstarts the production of tyrosinase. So there's that word again. Without tyrosinase, we cannot create pigment. So it is an essential ingredient in that production of hyperpigmentation, which is why we talk so much about tyrosinase inhibitors. If we can interrupt that process, then essentially we can turn off the receptor and stop that hyperpigmentation production. As I said, we will look more to that in just a second. Now, two types of melanin I have already mentioned. So we have pheomelanin and eumelanin. Now, the ratio of pheomelanin to eumelanin, along with the distribution of melanin within the skin layers, it contributes to a wide range of skin colours observed in individuals. So as I've mentioned, typically those lighter Fitzpatricks will have more pheomelanin, dark Fitzpatricks tend to have more eumelanin. And you can physically, if you zoom in even more on those melanocytes, if you were to look within the melanosomes, you can see the different molecular structure of the two types of melanin. And you will physically see, once those cells are stained, that eumelanin is a darker cell, pheomelanin is smaller, rounder, and lighter in appearance. Just to make sure that, we always point out this case, UV exposure produces both types of melanin, and that melanin is there as a protective mechanism. So looking at pheomelanin, as I've mentioned, it is more responsible for red and yellow pigments. Therefore, with your lighter Fitzpatrick skin types 1 and 2, that is why they are more prone to red hair. The function of pheomelanin, it doesn't provide the same level of UV protection as eumelanin do. So for those darker skin Fitzpatricks, especially your 5 and 6, they do get some natural skin protection from UV. However, as I say so many times every single day, is that SPF, sun protection should be worn regardless of skin type, regardless of Fitzpatrick. It should be used every single day. So that pheomelanin, lighter skin type, is more susceptible to damage from UV radiation. So its presence may be associated more with an increased sensitivity to sunburn, so a more reactive skin in terms of UV exposure. The function of eumelanin, again, as I've said, it does provide some natural skin protection from UV. However, we still need to make sure that the skin is protected. But this kind of brings to the point that Fitzpatrick skin typing within consultation has to be done effectively. So we need to properly determine what Fitzpatrick somebody actually is in order to safely then plan a skincare regime alongside treatment protocol. So skin Fitzpatrick is absolutely essential. Now, tyrosinase. So tyrosinase is a copper-containing enzyme, and it doesn't, on its own, does not just create pigmentation, it also has to be activated first. Now, glycosylation is the addition of sugar molecules into the tyrosine. So it's a bit like giving young children sugar at a time of day that really they shouldn't be having sugar. You then have to chase them around and try and calm them back down again. That addition of sugar in the process of glycosylation effectively is what wakes up the tyrosine and starts that interaction and melanin production. So the beginning of both melanogenesis pathways, regardless of type of melanin, tyrosinase is less effective in fair skin, more active in darker skin, which is why a lot of treatments like laser, very, very strong peels, for example, you really, really do need to be careful when treating darker Fitzpatricks because that tyrosinase is much more active. So inhibiting tyrosine is completely critical in terms of being able to treat hyperpigmentation. Now, thinking about that glycosylation process with the tyrosine, so it's the addition of sugar molecules effectively that wakes up that enzyme and begins the process. Let's think about then the lifestyle of our clients and patients. So high diets in sugar, potentially. Do we need to look at lifestyle as a potential cause for hyperpigmentation? So excessive sugar can have a number of different effects on a person's ability to produce hyperpigmentation. So when we have excessive sugar in our diet, we produce what's called glycation end products or advanced glycation end products, referred to as AGEs. So these produced advanced glycation. They've also been associated with skin aging as well, but potentially degrading collagen elastin. So there's one way that sugar can influence a person's skin health. Excessive sugar can also lead to inflammation within the skin. So high sugar diets can promote inflammation in the body, and chronic inflammation is always linked in some way to hyperpigmentation. Insulin resistance is an example. So diets high in sugar contribute to insulin resistance. So this has been linked to various metabolic changes that can affect skin health, again, potentially influencing hyperpigmentation. But of course, if you look at insulin resistance, anything involving insulin, we may be producing insulin-like growth factors, or IGF-1. So this can cause and have an influence on hormonal fluctuations. And of course, we know hormones is one of the triggers for producing hyperpigmentation. We're going to look at triggers in just a second. But first of all, just to have a closer look at that process of tyrosinase and how it kind of influences the production of hyperpigmentation. So there again, you have the two different types of melanin produced. So we're not going to look at the chemical structure, thankfully, of melanin formation typically, but it is a completely normal pathway for all skin types to produce neomelanin. So it's a completely normal procedure for the skin to produce that darker pigmentation. Looking closer at some of the steps that take place there, so we have that tyrosine production, which is produced through the body through the breakdown of another amino acid called phenylalanine. And it is then converted to what you see there is dopa or dehydroxyphenylalanine. And this is by the enzyme, as you can see, tyrosinase. So that phenylalanine formation also occurs with the presence of what's called cysteine, another amino acid. Dopaquinone then leads to the production of that phenylalanine. The lighter pigment responsible for your lighter hair, lighter eye colour, and potentially that kind of red appearance to skin and hair. So when we have that neomelanin formation, that dopaquinone can undergo a series of enzymatic reactions. Without that presence of cysteine, as you see with the production of phenylalanine, it then leads to the production of neomelanin. Always remember as well, the balance between phenylalanine and neomelanin is influenced very heavily by genetics. So when looking more closely at somebody's Fitzpatrick skin type, we talk about ethnicity of both parents. Now you can have one parent as a skin type 1, the other parent as a skin type 6. So that person then inherits both of those characteristics and potentially can have a mix of both types of melanin as well. So when we correctly identify Fitzpatrick skin typing, we can safely recommend a protocol treatment. So we look to identifying hyperpigmentation. So within a clinic setting, there's a number of different things that we can do. There are a number of different tools also that we can use in order to identify types of hyperpigmentation. Now, it's important that you become confident in visually being able to inspect the skin and confident in identifying the different types of pigmentation as well. So with visual inspection, obviously we are looking basically to identify areas where pigmentation is darker than natural skin colour. So when we've identified the areas of hyperpigmentation, we can then look to see if there's any type of other identifying factors that can tell us more about the type of pigmentation it actually is. Now, quite easily in terms of, we look at hormonal pigmentation, I'll tell you very quickly, is that the appearance of hormonal pigmentation tends to be very symmetrical. So melasma is the common name for hormonal pigmentation. If it is under here on the malar region of the face, it will also be on the other side of the face as well. So we'll have a look at the types of pigmentation in just a second, but that is one easy way to try and identify hormonal pigmentation. So of course, within any consultation procedure, when we first come to work with clients and patients, we have to take their history. So within that history, obviously, we want to rule out any potential contraindications, anything that medication-wise or health-wise would rule them out of any treatment you would suggest. So we look to also, as well in the addition of medications, medical history, we need to look at lifestyle in there as well, because sometimes indications from their lifestyle could give you an identifying trigger that could be causing their hyperpigmentation that initially they may not have picked upon. Look to the age of the person, gender as well. Females obviously have more of a hormonal changes that can influence pigmentation throughout their life, and also family history as well. So again, identifying Fitzpatrick skin typing. We can use things like Woods lamps, for examination purposes. Now, your Woods lamp it's not a specifically specialized tool, although it just gives you a closer look at the skin. So it is a black light device, and it just helps to identify more of a hormonal pigmentation, potentially some of those fungal infections that can also cause hyperpigmentation. You also have now the availability of things like skin scanners. So these are great in addition to any consultation that can literally break down different skin conditions and look closer at the health of a person's skin. Now, with dermatoscopy, we need to look here at identifying types of hyperpigmentation and making sure there are no dangers in terms of the hyperpigmentation that's been diagnosed. So some kind of sun damaged pigmentation, if it's raised, it's uneven in terms of its shape, then we need to be looking at potentially referring back to dermatology in order to safely be able to treat that particular patient. What we also want to be able to do, and this comes with the lifestyle element to a consultation, is to understand the potential triggers that can cause it. So we will have a look at those triggers now. So these tend to be the most common triggers that we see causing hyperpigmentation. Sun damage is always number one. Sun damage will make any type of pigmentation worse. So even if it's an inflammatory pigmentation that somebody is suffering with, exposure to UV will make that pigmentation worse. Age, as I kind of touched upon when we looked at the epidermal layers. So a lot of changes happen even just in the epidermis itself when we age. So one of the things specifically for females that happens is that the melanocyte cells begin to deplete. So as we lose estrogen, when we start to go through things like menopause, estrogen depletes the amount of melanocyte cells that we have within the basal layer. So this means a number of different things in terms of how the skin looks. This means that with fewer melanocyte cells, that deposit of pigment throughout the skin life cycle is much more uneven, it's much less. So skin for lighter Fitzpatricks can tend to look paler. So any clients or patients that are coming to you and saying, my skin just looks paler than it used to, it just doesn't seem to have any life anymore, it's that reduction in melanocyte cells that potentially has caused that to happen. Again, if we have fewer melanocyte cells, then when the cell itself is triggered to produce melanin, that deposit becomes much more uneven. So some areas within the epidermis become flooded with that melanin exposure, that melanosome movement into the keratinocyte cell. It becomes flooded. So that's when you start to see sun damage pigmentation, sunspots and age spots quite randomly in areas on the skin. So that's just a few ways that age can influence the epidermis itself and also the melanocyte cells. We also looked at hormones as a potential cause for hyperpigmentation. So your alpha MSH is something that we've covered already. It's produced by the pituitary gland, and it stimulates that melanocyte to produce melanin. So changes in those MSH levels can affect skin pigmentation. Now, specifically female, again, predominantly, we are looking at estrogen and progesterone. And when hormonal changes occur, be that through puberty at a very young age, pregnancy, and then eventually past menopause, it can influence and change that melanin production. Now, pregnancy in particular is one of the most common for female causes of that hormonal pigmentation, often referred to as the mask of pregnancy. Now it's called the mask of pregnancy because it literally will have that butterfly effect across the face with the darker areas making the skin look like it is physically wearing a mask. But of course, melasma and hormonal pigment can show itself in different ways as well. So medication, again, brings it back to that consultation and looking for identifying potential triggers. Are they taking any specific medications that may influence and affect that melanin production? So some drugs used in cancer treatment, some hormonal therapies, thinking about HRT as an example, and the contraceptive pill can influence the regulation of the melanocyte. Tissue inflammation, so inflammatory conditions specifically. Now, skin inflammation or injury can influence melanocyte activity, and sometimes you do see, even in the cases where an overaggressive treatment has taken place, and you get that resulting hyperpigmentation where the inflammation has been within the skin's tissues. Of course, inflammation can also lead to hypopigmentation. So hypopigmentation isn't something that we'll specifically cover today, but sometimes the question gets asked is, what is it that triggers that hypopigmentation? So again, there's a number of triggers for it, but it's not an issue with tyrosine, tyrosinase in particular. Hypopigmentation almost always is damage to the melanocyte, so it no longer functions the way that it should. Chemical agents, so here we're talking about the addition of products, topical things that we are introducing either to skincare or within treatments that are too strong, too inflammatory, and have that hyperpigmentation effect. And number 7 there, it should say genetic predisposition, but of course, again, we look back to Fitzpatrick skin typing and looking to the parents in terms of determining what type of melanin will be present in the skin and how much of that will determine skin color and skin reaction to certain things. The most common hyperpigmentation triggers, I keep saying, is that UV exposure. So UV comes in really 3 different forms, but the ones that we focus on more predominantly are UVA and UVB. So when we protect our skin against some damage, we're using SPF. We want to make sure that that SPF is broad spectrum and protects us against both UVA and UVB. Now, UVB, as you can see in the diagram there, stimulates the melanocyte to produce melanin as a protective response. This will shield the skin from further damage. Now, this process contributes to what's called DPD, or delayed pigment darkening, and this can occur a few days after UVB exposure. UVB, as you can see from the diagram, is going into the skin at a much shallower depth. So it results in what I would call UVB burn. So because it's more superficial in terms of how deeply it penetrates the skin, it has that instant effect of potentially inflammation, so redness, depending on skin type, potentially even blistering as a result of overexposure. And this UVB is where the risk of skin cancer is greater. So you risk that mutation within the DNA of your skin cells. Now, UVA radiation, as you can see again, that stimulates the skin much deeper. So I refer to UVA as UV aging because it is literally reaching the dermis of the skin. Now, the dermis is where we have all that structural support. All the collagen is present within the dermis. So if we have excessive exposure to UVA, that's when collagen starts to degrade. And if collagen degrades, we age much quicker. The long-term effects, obviously, is that advanced aging, but it is also potentially that free radical damage as well. So UVA also contributes to the immediate darkening of the skin, and that is known as immediate pigment darkening. So opposite to obviously the UVB is IPD. We also then have high energy visible or HEV light, which is on the visible light spectrum. So the sun does emit HEV, but so does electronic devices. So your computers, your smartphones, your tablets, things like that, is why, again, I say SPF is essential to use every single day, because what we also want to protect the skin from is that HEV light that potentially, not obviously as much as the UVA and UVB, but potentially can still be a trigger for hyperpigmentation. So Fitzpatrick is something that I have mentioned a number of times already. It must be part of your consultation procedure. So with a Fitzpatrick skin typing, you have a series of questions that must be answered with almost a multiple choice element to them. So it will ask things like natural hair colour, natural eye colour, ethnicity of parents, and most importantly, the skin's response to UV exposure. Now, type 1, type 2 skin type as well will be very reactive to that UV exposure. Remember that type 1, type 2, most predominantly, will have more of that pheomelanin present. Whereas your skin type 5 and 6 is a visibly darker skin type due to more presence of eumelanin, and it has that slightly natural element of UV protection as well. So this is a melanin color grading chart. Diagnosis must be given in terms of Fitzpatrick skin typing in order to safely treat these clients for hyperpigmentation. And don't forget as well, somebody with mixed race ethnicity will have both eumelanin and pheomelanin, and this will determine the correct course of action and safest course of action for them. So looking now to types of hyperpigmentation, I've already mentioned a few already, but what we're going to focus on today is that sun damage pigmentation, hormonal pigmentation, and also what's called post-inflammatory hyperpigmentation, or PIH. Now, as I mentioned in terms of diagnosis, visually we need to be able to inspect the skin and look to where that hyperpigmentation is placed, the colour of the pigmentation, as you can see on the skin, and also the size and shape. Now you can see, as I mentioned, that chloasma, which is just another name for things like melasma or hormonal pigmentation, it is very commonly across that malar region on the skin. But as I found with my last pregnancy, it can also just be in small areas above the lip is a very common area to suffer. So, hormonal pigmentation, first of all, in terms of colour, it does tend to be brown or greyish brown patches, often a little bit mottily in appearance. Now, the picture that I've shared with you there is actually a client of mine, and she first presented to me in August 2020. Now, hopefully you can see clearly just how the melasma itself is actually present on her skin. So you can see the majority is on the forehead area. You can also see, although it is a little bit blurry, that she does have that malar placement of hyperpigmentation just underneath her eyes. So it is very symmetrical in appearance. She'd been and tried a number of different treatments before finding myself in clinic. So things like laser and IPL had been attempted on her skin, which actually made the condition a lot worse. So again, the reason behind that was most probably because those kind of treatments have that very significant inflammatory response as a result. So it made it worse. But bear in mind also that she came to me in August 2020. Yes, it's the UK that we live in. We don't tend to have great summer, but this was the height of our summer. So What you will find with the client suffering with hyperpigmentation of hormonal influence is that they tend to present to you if it is the summer or if they've been away on holiday and that pigmentation has darkened. It's likely that the pigment was there previously, but it's that exposure to UV which makes it worse and makes the client and patient much more aware and that it is visible to them. So melasma typically is quite resistant in terms of its response to treatment. So it tends to be one of the most stubborn in order to be able to treat. However, it is very treatable with the right protocol in home care. So I will show you the after picture of this client in just a second. Post-inflammatory hyperpigmentation. So again, in terms of incidence of PIH, it tends to be more so for those skin types that are higher Fitzpatrick. So post-inflammatory hyperpigmentation, as the name suggests, is inflammatory in nature. So something externally has happened to the skin to create that inflammatory response. And the list could be endless in terms of what potentially that could be. Essentially, and I think there are some pictures towards the end from Genesis of exactly how that can appear when something has just been too aggressive in nature for the skin to actually handle. So as a result, it has that melanocyte stimulating effect, and it creates more of that new melanin sent to the surface of the skin in the areas specifically of inflammation. Now, the picture that you can see there is quite a classic example of PIH, and that is typically in a darker skin type again, but where acne has been previously. So it's that inflammation from things like acne that leaves behind this almost purpley brown spot of pigmentation. And it can rectify on its own, going through a number of different skin life cycles, providing the inflammation is no longer there. However, again, exposure to UV can make the condition a lot worse. Post-inflammatory hyperpigmentation anywhere on the face and body can be present. So generally, any areas where inflammation has occurred for whatever reason, that is what you are likely to see. Sun damage pigmentation. Again, I would say this is probably one of the most common types of pigmentation that you will see. And typically it tends to be present most obviously in areas that are exposed to UV. So face is very, very obvious. Neck, although sometimes you do tend to see that it leaves this area that is shielded by the chin. So you have even skin tone underneath the chin and then hyperpigmentation at the sides of the neck. Chest, of course, and as you can see from the picture, again, this is one of my clients who I've successfully treated. Hands are extremely, extremely common, and you can see exactly the kind of effect that UV sun damage pigmentation can have on the aging appearance of the skin. So with sun damage, liver spots, senile lentigos, a number of different names for the hyperpigmentation that can occur on the skin, typically in terms of size anywhere between 2 and 20 millimeters. And as a rule, because of the aging process and the changes that occur in the skin, you're looking at kind of 50 plus. However, if there's any issues with melanocytes, any kind of age group can be affected. Now, I mentioned with that MC1R defect within the skin, as I very obviously suffer with, effilades or freckles is another way that sun damage can present itself in hyperpigmentation. So I literally only have to be exposed to heat and it can trigger that hyperpigmentation, freckling of the skin. So we look now more towards the treatment of hyperpigmentation, and here we can focus on the different things that we can use within the Genesis professional treatment range. Now, I mentioned previously about inflammation. So with hyperpigmentation, generally we say aggressive treatment shouldn't be necessary, because where there's a presence of excessive inflammation, there's a chance that hyperpigmentation could actually be made worse, which we saw in the case of the lady that came to me with melasma and the previous treatments that were attempted with her. She ended up at a point where that melasma was just made worse. So too much inflammation wants to be avoided. It's a progressive treatment. It's necessary. And here we talk about treatments that support the skin, but alongside the correct home care protocols as well. So this is always something that's massively important with any skin condition and skin type, that if they're not supporting the professional treatments with the right skin care, they simply won't get the results. Just quickly to share with you the results of the two examples I had on the previous slides. So the results for the lady with melasma was done with a combination of healing agents and also microneedling as well. So this actually happened quite quickly. She was a younger individual, therefore the skin life cycle was actually working really efficiently. And of course, with exfoliating agents, that was happening even more so. Now, the example for the lady with pigmentation on her hands, that was actually after one treatment. So laser and IPL are very, very commonly effective in the treatment of sun damage hyperpigmentation. So those are just two examples of mine that I was happy to share with you. Now, looking at treatment specifically, so one of my favorite treatments for any condition, I'll be honest, but for hyperpigmentation as well, is the use of microneedling. So I do use in clinic the needle pen care. But when talking about microneedling, we can look at roller as well as a way to treat hyperpigmentation. Now, what we want to make sure that we are doing during that professional treatment is using the correct ingredients that support that reduction in melanocyte activity. So within the Genesis range, we have that SWS, or skin whitening solution, that we can use alongside a microneedling treatment. So let's look to microneedling and the benefits of microneedling in general. So we know that microneedling is fantastic for collagen induction. So yes, that means that the skin overall can be improved in terms of plumpness, fine lines and wrinkles, of course, and any scarring or textural issues. New collagen formation can also help improve the overall texture of the and the tone of the skin as well. So improving the skin texture, improving the skin's natural moisture factor as well, will make the skin more hydrated, be able to reflect light much easier, and as a result of that, can look much healthier. And so we talk about, of course, enhanced product absorption. So here we know that microneedling creates microchannels in the skin, and that allows for better absorption of topical treatment, which is why we have to be certain that we're using the correct products during this process. So microneedling also helps with skin renewal. So that controlled injury and subsequent healing process of the skin also improves that skin cell turnover. So this can then lead to shedding of hyperpigmented skin. So if we can encourage that skin cell life cycle, then we can effectively and quickly remove that surface hyperpigmentation. But there is also research to suggest that microneedling as a treatment can help to regulate melanin production or suppress the melanocyte itself. One thing I want to try and touch on here is, I get asked a lot about what's the correct needle depth to use for treatment of hyperpigmentation. Now, it's a very old school kind of way to do a treatment, is that you always need to get that blood or that pinpoint bleeding as a result of microneedling treatment. Well, actually, that isn't the case. Now we know that the epidermis itself differs in thickness depending on other areas of the body, but just in the face in general. So as a rule, I always say the end point for microneedling, specifically for hyperpigmentation, is that uniform erythema to the surface of the skin. So even in redness at the end of a microneedling treatment. So that redness is inflammation. Obviously, that inflammation then leads to that wound healing cascade. But what we don't want to do is go too deep. So we don't need that blood. We don't need that pinpoint bleeding, because that's an indication that we've reached the dermis. And as we know, if we've reached the dermis, we've actually gone past the melanocyte cell. So as a rule, the end result you want to be looking for is uniform erythema. So typically, you know, a treatment at 0.5, whether that's with the needle pen K or with the roller, can be beneficial in achieving results for hyperpigmentation. So just some before and afters, specifically for microneedling. So this was with a roller and the SWS power solution, as I suggested. This is the one that we need to use to achieve results. Because this is after only 2 sessions, with a week in between those 2 sessions. So it's very quickly, as you can see, it will have altered that skin life cycle. It's already started to improve the appearance of hyperpigmentation on the surface of the skin. So we look to SWS. So this is a professional solution with its aim being for skin depigmentation and whitening. So it's not going to whiten the skin effectively, but it does suppress the melanocyte and stop it from producing that excess melanin. So some of the ingredients we see in here, as we do with all of the professional solutions, we see that SH polypeptide 7, and that is a skin identical stem cell. So we see this particular ingredient within all of our professional solutions. We then have botanical stem cell extracts. So this helps to cure inflammation. But we have the melanin inhibiting properties of arbutin as well, which aids in skin lightening. Palmitol tripeptide 1 stimulates collagen production. And then we have other whitening and lightening effects as well. Kojic acid is a really important ingredient within the SWS solution. So it has very similar effects to hydroquinone, but we take away the negative side effects that we often see with the use of hydroquinone. So it's derived from a Japanese mushroom, and it is very effective as a lightening agent. It helps to inhibit that melanin production. We then have anti-inflammatory effect, which we know is massively important in terms of trying to calm any inflammation that may be exacerbating that hyperpigmentation as well. So we then have the SRS, which is the Professional Skin Renewal Healing System. So again, this is quite important ingredient-based treatment that we can provide for our patients and clients, but we can do so in a safe manner. So although it has quite a high amount of alpha hydroxy acids, it is an alpha hydroxy acid complex, it can be carried out quite safely for all of your skin types, for all of your types of hyperpigmentation. So within here we see the lactic acid, 13.5%. So this is an exfoliator, as all alpha hydroxy acids are. And its aim is to work on skin tone specifically. Now, glycolic acid, 15%. Again, it's a primary skin exfoliator. Now, don't forget that if we want to encourage the removal of surface pigmentation, then we have to use exfoliating agents. We then have mandelic acid at 2%. So mandelic acid is a fantastic anti-inflammatory ingredient. The molecular size of mandelic acid is a lot larger than a lot of your alpha hydroxy acids, which means that it doesn't penetrate the skin quite as quickly. It's non-irritating. So it's very good for that high Fitzpatrick that has a more active melanocyte cell. but also for anybody that suffers with perhaps maybe sensitized or sensitive skin as well. We then have the addition of phytic acid, which is a natural tyrosinase inhibitor, but it also has antioxidant properties also. And of course, that addition of SH polypeptide 7. This is going to encourage skin repair, cell production and regeneration, and also the effects of an anti-inflammatory extract. LED. Now, LED I use with practically you name it, I can use LED with. So LED generally is extremely beneficial for reducing any kind of inflammation in the skin. So here I've focused specifically on green light. So any kind of LED treatment, and depending on what you want to target, is very much dependent on the nanometers or wavelength of that particular light. So we find that green and the wavelength of green light suits the treatment of hyperpigmentation as it reaches a level in the skin where that melanocyte cell sits. And the impact specifically on the melanocyte is that it can have a regulatory effect. So the cells, the melanocyte cells themselves, if they are regulated, they essentially are calmed down, and that melanocyte activity is reduced. But of course, with LED, in particular the general lens infrared model, we have the ability to use 5 different potential settings. Very commonly, I would use red light post-treatment. So red light soothes inflammation, and is also collagen producing, so it supports that skin structure as well as having a regulatory effect. For those of you, sorry, I just want to go back to the SRS to give it a little bit more information about the treatment itself. Obviously, I don't really know in terms of what treatments you currently offer. The SRS is a peeling system, and you can apply directly to the skin without the need for any neutralization. So it can be used in conjunction with microneedling as a procedure. So for example, a protocol for SRS could be that you prepare the skin first of all, you apply the SRS solution, and then you can use either roller or pen at a depth of 0.5 with your Genesis power solution. So in this case, it would be an addition to your SWS. So that's just one suggested interval. And if you're using a depth of roller of 0.5, you can carry out the treatment roughly every 2 weeks. So that supports kind of skin cell renewal when we're using quite active exfoliators for the skin. At a lower needle depth or length, 0.25, for example, again, interval would be around about 2 weeks. If we're using a depth of anything over 0.5, that's when the interval needs to increase, and we need to look more towards the 4-weekly interval between each session. But just to kind of reiterate there, we can use the SRS as a preparation method for the skin before we needle, and then follow that needling procedure up with the SWS in conjunction. I just wanted to make that clear. So what we also have as well, again, not everybody will have this available to them, but we have what's called the Snow Cell Brightening Peel Kit. So this particular kit is an innovative peeling and rejuvenating program, and it improves hyperpigmentation by inhibiting that melanin production. But not only that, because it is a peel treatment, it exfoliates those dead surface skin cells and helps to brighten the appearance of the skin. So it comes in 2 different forms. So it has, as you can hopefully see from the picture there, you have the whitening snow cell peel activator alongside the enzyme powder. Now these 2 products are mixed together, and when they're mixed after about 15 minutes, it then incorporates that highly effective skin brightening property. So some of the ingredients that you find in here within the powder, you have actually vitamin C, which is your naturally occurring antioxidant. You also have kojic acid. Kojic acid is something that we've covered previously with the SWS, so that's important effect in terms of that similar to hydroquinone without the negative side effects. You then have amylglucosidase, which is an enzyme that has a whitening effect, breaks down arbutin. Within the activator, again, you see arbutin in there, which has melanin inhibiting properties. You have lactic acid, as we've mentioned already, which is that skin brightening ability, as well as that exfoliation ability as well. And it also has some anti-inflammatory ingredients alongside SH polypeptide 7. So just to recap, so SNORCEL specifically, again, it is a treatment that you can combine with other things. So you can combine it with microneedling as a procedure. Again, you're looking to about 0.5 millimeters in depth for the length of either needle and care treatment or roller treatment. And it is something that you do in before you carry out the microneedling procedure. So specifically, it is used as a tyrosinase inhibitor. So it's a tyrosine inhibitor during treatment. Of course, you want to then support the skin with tyrosinase inhibitors within home care as well. So it stops that tyrosine activation, which stops that stimulation of the melanocyte. It pulls it down. It has a regulatory effect on the melanocyte itself. And the ingredients that I've mentioned that do that specifically are arbutin, kojic acid, and also the vitamin C as well, with massive antioxidant properties. So some results, as you can see here, and again, quite quick in terms of how soon that effect can be visible. So this is with SNORCEL, and this is 2 sessions in conjunction with a 0.5 roller. And another example there, apologies if the image isn't too clear for you, hopefully it is, but this is with SNORCEL by itself over a period of 3 months. Now, SNORCEL you can carry out as a weekly treatment, but you can see that huge improvement there in terms of what we can see predominantly there is more of your UV-induced hyperpigmentation, and fantastic results, not only to the hyperpigmentation itself, but skin tone overall. Don't forget, it is a full face treatment. But one thing maybe is good to kind of emphasize here is that sometimes I get asked if there's a small amount of pigmentation, if it's sun damage pigmentation, can you spot treat that hyperpigmentation? You can, but what tends to happen in that respect is that if you're not treating a full face, you find that the melanocytes that surround it still triggered by that tyrosine. They are still likely to deposit pigment in other areas. So although we might remove the issue that they were concerned about, it's likely that hyperpigmentation can occur elsewhere as well. So we have available the EZCO2 mask, which again I've popped into the treatment element of hyperpigmentation, purely because again I use this very often in conjunction with microneedling, as we have seen with a number of the previous treatments that we can do. So this is what I would refer to as skin preparation. So it has, if you're not familiar, it has the EZCO2 gel in combination with the EZCO2 mask. Now the gel is applied to the skin, a full tube of gel is applied to the whole face, and then the mask is applied on top of that gel. Now when those two products meet, that is when a reaction occurs within the skin. So it's similar to what's called Bohr effect within the skin. So this is the vitalized metabolism of CO2, and it's realized by increased oxygen supply from the red blood cells that raise the oxygen partial pressure within the cell. So effectively what you are doing is bringing the blood supply, improving the blood supply to the surface of the skin, and improving the health of those blood vessels themselves before you microneedle. So it has a beneficial effect when used in conjunction with microneedling. It is also still beneficial when used on its own and can be quite a quick and pleasant treatment to have for clients by itself. So this particular treatment has skin brightening effects, which can be seen very visibly after just 10 to 15 minutes of treatment with this. It helps to improve skin texture and improve blood flow as well, as I've just mentioned. So product recommendations. So what we want to make sure is that when we have given our patients and clients a protocol to follow in terms of treatment recommendations, we must also support that with home care use. And as I mentioned at the beginning, we are very fortunate within the Genesis range that we have a large number of products available for us to use. So I'll look now at some very specific hyperpigmentation targeting products. And essentially what we can achieve for the skin. Now, before I do that, I just want to point out that hyperpigmentation treatment is always continuous. Now, I view it as a bit of a triangle. So there are 3 elements to continuous treatment of hyperpigmentation. So this is outside of the treatment room. So we must make sure that we are using agents or ingredients that have an exfoliatory effect on the skin. So we want to remove those dead skin cells. We want to keep that skin life cycle as quick as we possibly can to remove surface pigmentation. In addition to that, we have to have something within our home care that is a tyrosinase inhibitor. If we cannot break that cycle of tyrosine within the skin, stimulating that pigment production, then it just won't be successful. SPF, as I've already mentioned, has to be used every single day, regardless of the season, regardless of skin Fitzpatrick. You have to use SPF every single day. Now, if either of those elements, if any of those 3 elements are missing, it won't work. So we have to make sure that triangle is always complete. One fact that I've always, and I do kind of bring it home to clients of mine, is that if either of those elements that we've just covered are missing, for example, SPF, one of the most important ones, if we don't protect our skin, a single day of unprotected UV exposure over a 9-month period, that single day we don't, or you forget to use that SPF, can completely break the cycle and start that hyperpigmentation production again. So always kind of hammer home that SPF is completely necessary. Now, looking at some beneficial ingredients now, some of them we've already covered in terms of what's available within some of the professional treatments. And of course, some of these are also in the home care that we can use to support those professional treatments. So kojic acid, as I've mentioned, is a natural tyrosinase inhibitor. Your alpha, beta, or polyhydroxy acids are an effective form of exfoliation. So exfoliation to remove dead surface skin cells will keep the skin tone even. It will keep the skin texture even also, and it will just improve the skin appearance overall. Alpha-arbutin is a natural skin lightener. Anything that's anti-inflammatory, aloe vera is there as an example. We need that anti-inflammatory element to any hyperpigmentation home care in order to support and protect that hyperpigmented skin. Vitamin C is an antioxidant. Bakuchiol, which is a plant-based retinol. So retinol, again, has a powerful rejuvenating effect on the skin. It also has a slight exfoliatory effect as well. Niacinamide is there to not only boost hydration, support other active ingredients, and also help to protect the skin barrier itself. And we are very lucky now to have within some of our new products released at the end of this year, that Mela Zero complex, which is specifically for hyperpigmented skin. So I'll have a little look at exactly that just now. So at the end of this year, we've introduced 4 new products. One of those new products is the Multivita Radiant Serum. Now, the amazing thing about this particular serum is that introduction of that Mela Zero complex. So this is actually a patented complex which helps to inhibit the melanin production by that alpha melanocyte stimulating hormone. So it reduces tyrosinase expression and promotes melanin decomposition by something that's called melanosome autophagy. So essentially what it does is it sweeps out and removes any damaged melanosomes away from the skin and reduces that melanosome activity. What you also see within the serum is the Vita-12 complex, which is also present in the next product that I will mention. And that is a complex of 12 vitamins in total. Now, for example, vitamin A, vitamin B3, B12, C, E, F, H, and K are some of the vitamins that you will find within the serum. So it is also present in the Multivita Radiance cream, which I'll cover next. Glutathione is, again, another fantastic ingredient in terms of calming the melanocytes, improving the health of the skin, and panthenol as well. This is a panthenol-rich formula. Panthenol effectively it provides protection in the form of an anti-inflammatory ingredient, but also helps to provide deep moisture to the skin. We have within here also what's called a polyhydroxy acid in the form of gluconolactone. This helps to improve your skin tone by exfoliating the dead surface skin cells. And we have an anti-inflammatory root extract or licorice root extract, which also targets hyperpigmentation by preventing that tyrosinase activation. So for this serum specifically, there has been a number of tests conducted in order to test its significance in its success to be able to treat hyperpigmented skin. Now, that Mela Zero complex, as I mentioned, is that patented ingredient for inhibiting melanin production and removing those damaged melanosomes from the skin. Now, as you can see, quite a short period of time in terms of the effectiveness of this serum has been tested. So we look from week 0 to week 4, so a period of a month, to look to how the serum has physically changed the skin. Now, obviously, for the purpose of this webinar, we are focusing on hyperpigmentation. As you can see, there has been an improvement in a short space of time, as there has been for skin tone as well. But because of that anti-inflammatory complex, also, we see a reduction in things like erythema, skin sensitivity, or sensitized skin. So it has that anti-inflammatory ability, which of course is important for any hyperpigmentation focused product. What we've also been able to do is conduct clinical trials for both this and the following product, which is the Multivita Radiance cream. So fantastically, what was found and discovered again over a period of time is that skin surface melanin after only 2 weeks of use, when looked closely and monitored, was significantly reduced. Now, that's a fantastic result for this brand new serum. So I mentioned we can use this Multivita Radiance cream with the addition of that astaxanthin alongside the Multivita Radiance serum. So one point I'll just make, if you haven't already been part of the new product webinar, which is available for you should you wish to view it, the Multivita Radiance serum replaces the Home Care SWS. So although it still forms part of your professional treatments, the SWS, the multivitamin radiant serum will be what you would use to target hyperpigmentation within the home care. So the MVC, or multivitamin radiance cream, has that astaxanthin as an additional ingredient there, which massively benefits the skin in terms of hyperpigmentation. So it is shown or known to be 6,000 times stronger than vitamin C in terms of its antioxidant power. So when used in conjunction with the vitamin C that we find in the serum, which namely is 3,0-ethyl ascorbic acid, so it's not pure vitamin C within the serum, it is actually a more stable and skin-friendly form of vitamin C. So we can then pair that with the astaxanthin that we find within the MVC. Again, you have that Vita 12 complex, which is the complex of 12 vitamins in total. You have more of that gluconolactone, which is a polyhydroxy acid, which is going to enable that exfoliation of skin cells, and licorice root extract as well as in the serum. Again, this cream has been studied. We've conducted clinical trials for this particular cream. And again, after 2 weeks of use, we can find that the skin melanin or surface melanin within the skin was 29.74% improved. So again, that's fantastic results. And of course, great to be able to show any of your potential clients that these two products specifically are used to improve the appearance of surface melanin. I've said it many times before, and I will say it again. Protect the skin always. And again, within the Genesis range, you've got a number of different ways that you can actually do that. So we're very familiar with the multi-sim cream. We also now have the new SPF, which has been newly introduced at the end of this year, and that's your Ultra Shield Sun Cream. So that is a factor 50 product, 50 plus. It's a very high UVA and UVB protection. So SPF products must be recommended, and of course, your clients, your patients need to choose the type of SPF that suits their skin type. As I mentioned previously, 1 day of unprotected skin within a 9-month period can undo any progress that has been made in terms of treatment and home care. So products to support skin types. So obviously our focus today has been on hyperpigmentation, but for any of your clients and patients that are wanting to have hyperpigmentation treated, there is also a skin type underlying as well. So that basically means that let's look to hyperpigmentation as the focus, but we also need to be able to treat their skin type. So if the skin is very dry, you've got things like moisture replenishing hyaluron serum and cream that they can use in conjunction with the targeted hyperpigmentation home care products. So identify within that consultation, yes, you are focusing on hyperpigmentation, but also let's support their skin type, their natural skin type. Do they need hydrating products? Do they need oil control? Is it anti-aging alongside the hyperpigmentation? Because obviously sometimes hyperpigmentation is as a result of aging. So let's use products in conjunction with both their skin condition and skin type. I mentioned previously as well, again, kind of focusing on the different types of pigmentation and products that would be needed. This is an example of a burn from a laser. So it's in an inflammatory pigmentation. It's very severe in nature, and we have to then control that inflammation within the skin. So no treatment has been necessary here. The only product that has been used is the Soothing Repair Post Cream. So this is a number of 3 applications throughout the day with no other products, just simply focusing on that Soothing Repair Post Cream in order to soothe that inflammatory skin pigmentation. And again, another example of that Soothing Repair Post Cream. The issue here, it was not Genesis treatment. Obviously, this was the wrong microneedling treatment used, and as a result, it has caused extreme inflammatory pigmentation of around the mouth and on the forehead as well. So this again is an example of the Soothing Repair Post Cream. Number of applications per day for applications. So more of an intensive application throughout the course of the day, used until that inflammation has been reduced. So I kind of come to the end of hyperpigmentation webinar. There are always, as there is for many different topics, so much more that we could actually cover. So of course, if you have any other questions about other treatments or other treatment protocols that you would like to ask, we are always available after the webinar in order to answer those questions for you. I thank you so much for joining me today. It's been a pleasure to be with you so close to the holiday season. So I wish you all the best in terms of hopefully you get some time to relax, spend some time with family, and then reinvigorated, ready to start the new year with all of the Genesis range. So if you do have any questions, please feel free to add them into the chat now. I'll say if there's anything that I can't answer, obviously we can come back to you with that. But if you do have any other questions, I will stay and listen. But again, thank you for attending today. I hope it's been useful for you. And if you've got any feedback in terms of things that you would like for us to offer you, please do get in contact. Thank you. Jeremy has just put into the chat, Epi Turnover Boosting Peeling Gel is a fantastic product to actually use. And I'm so upset that it isn't in the presentation because it is in my bathroom cabinet and it is something that I use quite often. So yes, absolutely. Epi Turnover Boosting Peeling Gel is another fantastic product that can be used. Thank you, Jeremy. Right, if there are no other questions, then we'll end it there. Thank you again for attending, and we hope to see you very soon.